Namaste and welcome to Yoga for Amputees, Yoga for Lower Back Pain. In this short practice, I'm going to be helping to relieve some of the lower back pain that can happen as a result of being both a leg or arm amputee. A lot of different reasons can happen for this difficulty with our lower back. Asymmetry, overcompensation with other muscles, leaning into the trunk, habitual behavior, lack of exercise, depression, poor digestion, those all can play in to reasons why our lower back might be bothering us. So the idea with this practice is to balance things out. So if you are somebody who's dealing with severe back injuries, this practice is not recommended for you at all. You want to go to a back specialist or deal with a yoga therapist who specializes in back pain. This is a very generic practice. To get you started, you want to have a chair, yoga blocks, these little yoga balls that are going to help release our glutes, like so. Okay, it's sort of a firm ball, but just enough to help release tension in the glute. And we have a puppy who wants a ball. And then we have our folded blanket, which can help with just protecting our knees, etc. So little Emily is our yoga dog. She may or may not join us, apparently. So to get us started, you want to find a comfortable seat. So as an amputee, that can mean lots of different things. It could mean that you're sitting on the edge of a pillow or a blanket. It could be that your seat is extending your legs out. You want to make sure that your spine is nice and long. So it also could mean leaning against a wall or even sitting in a chair. This practice is assuming that you're wearing your prosthetic legs. There are other yoga practices through our Yoga for Amputees on Demand site where you're not wearing prosthetics. Floor practices, standing practices, those are all available. So let's start by finding our breath. The breath is also one of the ways that we can help relieve back pain. So we're going to do a front and back body breath. We're going to invite the breath to rise up through the front of the body and then breathe out, settle along the back of the body. And continue, breathe in and breathe out along the back of the body. And one more time. Great. We're just going to do a little swing, side to side, start to stretch and open the sides of the body, release the neck and shoulders by letting the head follow the rhythm and wave of the spine. And then just kind of rock forward and around the spine as you go back. Come forward, round back, and then reverse. Arch forward and round back. Arch forward and round back. Last time. Good. Our first pose is cat and cow. So if you're not coming on your hands and knees today, I'll show you how you can do this. See that? You just arch up like so and round back. We're going to do 3 of those. So you can join us, extending, breathing in, and exhale, rounding back. For others, we're going to use our hands and knees. Now for some of you, you might have a lot of scar tissue. You can't bend your knee a lot, so you want to take your yoga blanket or a folded blanket, maybe perhaps put it underneath your prosthetic leg, depends on the hip height. You want to have the balance in the hips, like so. Okay? And from here, I'm going to tuck under and round the spine, exhale. And then inhale, arch up. Exhale, round. And inhale, arch up. And again, if you're seated, do what I showed you. Rounding your spine and then extending. Now we're going to go into our tail. So you want to, rather than a back bend, Little pull in. Just going to swish your tail side to side. We're going to swish our tail over towards the left and turn our head and torso towards the left. Swish our tail over to the right and turn the head and torso to the right. And back. And forth. One more time. Good. Now you notice that I have yoga blocks in a chair here because our next pose is Adho Mukha Svanasana, downward facing dog. I'm going to use my yoga blocks to come into this pose. And I'll show you a variation you can do using a chair. So let me move this blanket. I'm going to rock forward, tuck under with my tail, and fold into this downward facing dog here, extending the spine. I may want to have my hands on a chair. I may want to have a soft bend in my knees to protect my lower back. Fill up my lower back by tucking under a little bit if I tend to be an overextender. Or I could bring my heels to a wall to help get feedback into the hamstrings as I'm in my downward dog. And we're going to do a little exercise here. We're going to bend the knees and round the upper spine. Exhale. And inhale a little bit of a tilt and extend. We did this just a second ago in our cat and cow. We round and extend. Good. Good. And round. And extend. From here, we're going to step our right foot forward. So it may be that you take a few steps forward and maybe bring the back foot in a little bit so that you feel support. And bring your hand, either your right hand to your chair or a yoga block. I'm going to use the chair here. So you're going to reach your hand here or the block. You want to think about pivoting open and reaching the other arm up. This is Trikonasana, triangle pose. And then if you can, you might have to lift your back leg up, hold onto your chair or your blocks, and pivot around and come back to your downward dog. Perhaps you're using the chair, the blocks, or even the floor. Breathing in and out. We're going to step the left foot forward. And again, the right foot may need to come in a little closer, depending on where your balance is. Your right foot's going to come all the way, and I'm going to show you with my prosthetic foot how that looks. And now if I'm feeling really, really uncertain with this pose, I can pivot. So my foot is actually pressing into a wall, like so. I'm going to pivot through the back foot, which is my right foot. I'm going to bend my knees a little bit to make sure that I'm stable. Then I'm going to bring my left hand to the chair and open up. So now you see the back of the body. Now we want to focus on our little tailbone here. So I'm going to move back a little bit here. The tendency can be to dip the tailbone up and out, or to be here, rounding the spine. So a lot of us are here. If that's the case, come a little closer, bend the knees a little more, do a little less. Okay, this is a beautiful triangle right here. You're trying to heal your lower back and support your lower back. So if you're feeling a torque in your lower back, that's a pretty good indication that you have something going on in your back leg as well. Okay, you might need to turn it a little more. You might need to do a little less turn out. And then pivot around onto the back foot. And back you go to downward facing dog. Breathe in and out. Bend the knees and walk forward. And come to standing mountain. Like so. The next pose is a balance pose, but it's meant to release our lower back. You can do this in a chair. I'm going to show you standing for this purpose for today's class. I'm holding onto the chair and I'm actually leaning my bottom into the wall. I'm going to lift my left leg up and just cross it over a little bit to the right, back, and down. And other side, lift the right leg up, cross over, back, and down. It's just a little bit of release for your lower back after those two poses. You're going to come down onto your belly. So whatever way you do that, gently, safely, do so now. The rest of our poses in this practice are going to be on the floor. Sphinx pose. Again, I have yoga blocks in case, and I have a folded blanket. I'm going to fold it just halfway, like so. I'm going to show you without the props and with the props how you can do Sphinx pose. Now again, if you have the use of a wall and you're wearing your prosthetics, you may want to have those feet pressing right into the wall, okay? Otherwise, roll onto your belly and bring your belly down. Your forehead comes to the floor. Now this is deceptive here because you could think it's all in your upper body, but there's a lot going on in your lower body, which is why it can be really helpful to have your feet pressing into a wall, that you get that activation in your lower body. You're going to bring your attention to your tailbone, okay? So rather than focusing on squeezing the glutes, which is not actually a good idea, you want to think about dropping the tailbone. You're just going to create a little stretch in your hip flexors and poop up your lower back. Now go into your kidneys. Imagine that your kidneys are pooping up, okay? And that your shoulders are rolling back. And that's going to make it possible for you to come onto your elbows. Your elbows are close to your chest. And one by one, walk your elbows forward and bring your elbows underneath your shoulders. Now, as an amputee, there's a couple of things you want to be mindful of. It could be that your prosthetic leg is much thinner than your other leg or much thicker. If it's thicker, you might need to put a little folded blanket under your non-prosthetic leg. If it's thinner, you might need to put a folded blanket under your prosthetic knee. And we're going to activate this pose by spreading the fingers and drawing the elbows back as we lengthen the chest and lift up. If you're starting to feel a lot of compression in your lower back, come out a little farther, drop your tail and bring your chin to your chest and just work on strengthening your midsection very slowly. Another option, if Sphinx is not for you today, is to come onto your forehead and bring your hands more in line with your shoulders. I'm going to go back to the lower body, and again, this is our tail. Drop our tail and bring our fingertips up onto the ground. Okay, so your palms are lifted up and your elbows are lifted up and your shoulder blades are drawing back. Now this is another option. It's a little bit more of a strength building pose, but it can be a little less strenuous on your back. Your elbows are a little wider than your Sphinx pose, obviously, here. Take a breath in. Press into your lower body. That includes your legs, whatever you have. Keep dropping your tail and float the head up just a little bit. Long enough to feel strength in the legs, firmness in the glutes, without strain in the lower back. And lower down. Turn your head to one side. Relax and release. Take a breath in. And we'll go into our locust pose. Take a breath in. And we're going to roll over onto our back and get ready for bridge pose. I want to show you some options for bridge pose with prosthetics. So one of the things you can do is to bring your feet to the wall and your knees parallel. I'm going to show you this first. And your arms are by your side. Now we've already done cat and cow and arches and release. And be really mindful of not overextending into an arch here as we come up. Your arms come to your side and you tuck under. We're just going to go halfway, and the feedback in the thighs is really important with the feet pressing into the wall. That's an option for you. If you're feeling like you don't need the wall, a couple of things might be going on with your knees. Okay, so if you're above knee and you're wearing your prosthesis, you can bring your foot real close in to your buttocks. For others, like myself, the knee might not bend as much. You're putting a little more pressure on that non-prosthetic leg. So as you press up, make sure you're really pressing into that prosthetic heel as well, tucking under and lifting up until you come to a bridge pose that works for you. Now it could be that you fold more deeply here because it can be a lot of intense awareness and opening in those hip flexors. But this again is to strengthen the quads, stretch them, and to stretch and strengthen the hamstrings. When we start to do that, we use the muscles we're supposed to use as opposed to using our compensatory joints and ligaments here in the lower back. Take a breath in and exhale, release it down. Now this is not for you if you have, again, any neck injuries, high blood pressure, you don't want your head above your heart in any way, shape, or form. You're going to tuck under again, and this time take your yoga block and place it either at the lowest or the medium, just at your lower back. So this is more to just release the hip flexors without all the pressure and balance challenges. Now over time you may get used to this. Bring your feet more parallel so they're underneath, the heels are underneath your knees. Use your upper body, spread your fingers, use your elbows, your shoulders, draw your shoulders in, and you may over time lift up for a second and then come down, like so. We'll do that one more time. Lift up and come down. Release your block. Come all the way down. And we're going to hug what you've got into your belly. And rock side to side. That releases your back here. Swaying side to side. And that'll get us ready for our final pose in this short sequence, which is a knee down twist. So before we bring the legs over, you want to notice if you're getting pull in your back as your knees go to one side. If that's happening, bring your prosthetic feet down to the ground and let the hips and knees sway over towards the left. Now that could mean that you need some support, perhaps a yoga block, or a pillow, or a folded blanket. Your arms come into a T position, and your head can either roll over in the same direction as the knees, over to the left, or you can turn your head in the opposite way. Now for some of you, this feels like a lot here. You can actually put a folded blanket between your thighs, or even a yoga block, and just allow your body to begin to settle and release. Tuck under with your tailbone as you inhale and come back. And let's bring those legs over to the other side. This time we're going to lift the legs up. Bring them right over. This is another option. And I'm going to turn my head in the opposite direction. You'll notice my leg is way up. So I'm going to take my yoga block and put it between the thighs. And then inhale everything back. Let's come into Savasana, and then we're going to release our glutes before we close. So in this Savasana, I'm just going to give you an option to relax your back. And that is to take your chair, the seat of your chair. And again, if this is too high, if you have high blood pressure, you're not going to do this. But you can come real close to your chair and bring your legs on top. and relax. And some people like to put a little blanket underneath their belly or on their belly or over their whole body, like so. Or even a yoga block. Just remind the belly to relax and the lower back to release. So if this is strenuous in any way, in your neck, with your breath, you're going to extend your legs out. Like so. And I recommend for some of you, it may be more helpful to roll up your blanket and put it underneath your knees. Just to avoid that pull from the prosthetic, weight of the prosthetic pulling on the hamstrings or the hip flexors. You want to tuck under again by pulling the flesh of the buttocks down and releasing. Shoulder blades draw together. Close your eyes and take a few moments to absorb your practice. You can stay in this Savasana relaxation as long as you like. I'm just going to be guiding you through one more little movement to help release your back, rolling to your side, coming up into a seat. So I want to show you some options that you can do with a yoga block, or if you have one of these little yoga balls, you can take it right underneath your glute, not on your tailbone, and just roll around a little bit to release the glute muscles. The glutes can get incredibly tight because, again, they're compensating for the fact that you don't have any plantar flexion in your foot anymore to land that foot on the ground. So just releasing the glutes a little bit on each side. I'll show you with the ball on this side. You can also do this with the edge of a yoga block. Like so. Take the yoga block and just sit right on the edge of the corner. This requires you to have a little bit of upper body strength here. And you just kind of rock around on it. And you'll find that place where it's the sweet spot that's also the icky spot, right? It can feel uncomfortable, but also know that you're releasing and stretching. And then slowly come back to your seat. Find the right seat for you. Close the eyes and lengthen the spine. We're going to do our soothing breath again to calm and cool the body and relax the lower back. Inhale, the breath floats up to the front of the body. And exhale, the breath drops down the back of the body. And continue. Feel your body as three-dimensional, moving horizontally, vertically, and sagittally, front and back. Inhale, breathe in, and exhale, back to the heart, Anahata Chakra. Unstruck sound. Hari Om Shanti. 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 Peace.